everybody, my name is Francisca Valderas and I am the laser technician and Ultherapist here at Dr. Atagi's. Today we're going to talk a little bit about Ultherapy, and we're going to do a demo on Caitlin so you can kind of see what the procedure looks like and what the images look like. And hopefully you guys will get a lot of information out of this. Ultherapy is the only non-invasive skin tightening device that's been approved by the FDA to lift and tighten the skin on the brow, the lower face, underneath the chin, the neck, and the décolleté. So there's little or no downtime for this procedure. People love Ultherapy because they can go to work and nobody would know they had any procedures done. Unlike laser where you're red and you have flaky, peely skin, this does not do that. So Ultherapy is great for people that are starting to get a lot of kind of saggy skin or starting to notice a lot of laxity in their skin. Some jowling, it's great for the lower face. If you have a lot of lines in the décolleté, it's great for that too. It's also great for people that are not candidates for surgery. A lot of people have medical conditions that don't allow them to have surgery. So this is a great alternative because it's non-invasive. It's also great for people that have had surgery and they just want to maintain their results from surgery. And it's also great for younger people like Caitlin here that don't really have much, but they want to prevent aging, and this is a great way to do that as well. So Ultherapy works by sending ultrasonic energy down into the skin. It goes deeper than any laser can, so it's right above the muscle, and it targets the collagen layer of the skin and triggers it to tighten back up again. So that's a little bit how Ultherapy works, and I'll demonstrate it here. The thing I love about Ultherapy is you can see right into somebody's skin using ultrasound, so you can tell exactly where you're at so that you're not putting that energy into muscle or bone because that would hurt and you wouldn't get a result from that. So because we're relying on our own skin to trigger collagen, it takes typically anywhere from 3 to 6 months to see the results on this. It doesn't happen right away, but you see a progression every month and it does look better every month. But it can take the full 6 months to see the results. So because we're delivering energy into the skin, it can be a little painful at times. Usually most people like to take 800 milligrams of ibuprofen and they're fine with that. If you know that your pain tolerance is a little bit lower or you might need a little bit more, we can always prescribe medicine for you. So we can definitely do that, but most people do really well with 800 milligrams of ibuprofen. A typical treatment for full face usually only takes about an hour. Full face and neck can sometimes take 90 minutes. If you're doing smaller areas like the brow or underneath the chin, that's a 30-minute treatment. So it's not a long treatment, but we definitely want you comfortable when you come in. So I'm going to kind of show you a little bit about how the treatment is done. We've already cleaned Caitlin's face and we have taken pictures, and I've marked the areas here. Marking is really important because we have a lot of vessels and nerves that we don't want to go over, so marking is really important. So I've already marked her face here, and I'll kind of show you how Ultherapy works. We take a little bit of ultrasound gel and just kind of a really light layer over this area. And this handpiece here has different transducers, and we can go different depths depending on your skin. Everybody's skin is different. Everybody has different thicknesses of skin, so we can adjust it and personalize it for your treatment. So we take the handpiece and we just go over the area and kind of scan this here. I can see directly into her skin with the Ultherapy machine, with the ultrasound. And when I know I'm exactly in the depth where the collagen is, I can deliver energy. And are you ready? I'm going to deliver one pulse. And when we deliver a pulse, we move up, we make sure that we're in the treatment zone, and we deliver again. So for treatment, usually it's about 60 pulses per area on the lower face, and then I like to go over it again slightly more superficial so that we're targeting the top layers of collagen as well. So for each treatment, we usually do about 2 passes per area. Are you okay?
Yeah.
So then I would just change that out. I would continue this whole side. I would continue underneath the chin, and then continue on this side. So that's usually how the treatment goes. Very comfortable if you've taken your meds. I don't recommend that you do it without. But that's a little bit about Ultherapy, and if you have any other questions, you can call our office. We'd be happy to do a personal consultation for you, and we'd be happy to give you our suggestion and let you know if you're a candidate for Ultherapy. So call our office and schedule a consult, and thank you so much for tuning in.